This video is for educational purposes only. This video is not designed to and does not provide medical advice, professional diagnosis, opinion, treatment or services to you or to any other individual. Through my videos, general information for educational purposes only. The information provided in this video is not a substitute for medical or professional care, and you should not use the information in place of a visit, call consultation or the advice of your physician or other healthcare provider. In this video I'm going to talk about low back pain, classification, its causes, physical examination, investigation, treatment, approach to the patient with low back pain. Before we progress with this video, please subscribe to our channel and press the bell icon, and for more information please watch this video till the end. Moving ahead, let's first see what is exactly the pain. An unpleasant sensory and emotional experience associated with actual or potential tissue damage or described above in terms of such damage. Now let's see the classification. Axial pain, in soft tissue, muscles, ligaments, fascia. Referred pain, e.g. degenerative disc disease in low back. It can cause referred pain to the hips and posterior thighs. Radicular pain follows nerve path to arm or leg and accompanied by weakness or numbness. Causes. Congenital causes. Spina bifida, lumbar scoliosis, spondylolysis, spondylolithisis. Transitional vertebra, facet tropism. Traumatic causes. Sprain, strain, vertebral fractures, prolapsed disc. Inflammatory causes. Tuberculosis, ankylosing spondylitis, serongate spondarthritis (ACSA). Degenerative, osteoarthritis. Neoplastic causes are benign, osteoid osteoma, eosinophilic granuloma, malignant. Primary, multiple myeloma, lymphoma. Secondaries from other sites. Metabolic causes. Osteoporosis, osteomalacia. Pain referred from viscera. Genitourinary diseases. Gynecological diseases. Miscellaneous causes. Functional back pain. Postural back pain. Protuberant abdomen. Occupational bad posture. Habitual bad posture. Postural and traumatic back pains are among the commonest. Back pain could be a feature of an extraspinal disease like a genitourinary or gynecological disease. The following findings in the clinical examination are helpful in reaching a diagnosis. History. Age. Some diseases are commoner at a particular age. Back pain is uncommon in children, but if present, it is often due to some organic disease. This is different from adults, in whom psychological factors play an important role in producing back pain. In adolescents, postural and traumatic back pain are commoner. In adults, ankylosing spondylitis and disc prolapse are common. In elderly persons, degenerative arthritis, osteoporosis, and metastatic bone disease are usually the cause. Sex. Back pain is commoner in women who have had several pregnancies, lack of exercise leading to poor muscle tone, and nutritional osteomalacia are contributory factors in these patients. Some women put on a lot of weight during pregnancy and later develop mechanical back pain. Occupation. A history regarding the patient's occupation may provide valuable clues to risk factors responsible for back pain. These are often not apparent to the patient and could be a part of his routine. People in sedentary jobs are more vulnerable to back pain than those whose work involves varied activities. Past history. A past history of having suffered from a spinal disease such as a traumatic or inflammatory disease may point to that as the possible cause of back pain. Features of pain. The following features are to be noted. Location. Pain may be located in the lower, middle or upper back. Disc prolapse and degenerative spondylitis occur in the lower lumbar spine. Infection and trauma occur in the dorso-lumbar spine. Onset: often, there is a history of significant trauma immediately preceding an episode of back pain and may indicate a traumatic pathology such as a fracture, ligament sprain, muscle strain etc. A precipitating history is presenting out 40% cases of disc prolapse. The trauma may not particularly be a significant one. It may be subtle, resulting from a routine activity such as twisting to pull something out of a drawer. Careful questioning regarding leisure activities and exercise is important because inconsistency in activity levels during work and leisure time can precipitate back pain. Localization of pain: pain arising from a tendon or muscle injury is localized, whereas that originating from deeper structure is diffuse. Often, pain referred to a dermatom of the lower limb, with associated neurological signs pertaining to a particular root, points to nerve root entrapment. Progress of the pain: in traumatic conditions or in acute disc prolapse, pain is maximum at the onset and then gradually subsides over days or weeks. Back pain due to disc prolapse often has periods of remissions and exacerbations. Anarthritic or spondylitic pain is more constant and is aggravated by activity. Pain due to infection or tumor takes a progressive course with nothing causing relief. Relieving and aggravating factors: most back pains are worsened by activity and relieved by rest. Pain due to ankylosing spondylitis and serongate spondylarthritis (SSA) is typically worse after rest and improves with activity. Severe back pain at night that responds to aspirin may indicate a benign tumor. Pain initiated on walking or standing and relieved by rest is a feature of spinal stenosis. An increase in pain during menstruation may indicate a gynecological pathology. Associated symptoms: the following associated symptoms may point to the cause of back pain. Stiffness: it is associated with most painful backs, but it is a prominent symptom in pain due to ankylosing spondylitis, more so early in the morning. There may be an associated limitation of chest expansion. In some rheumatic diseases, back pain may be the presenting feature, but on detailed questioning one may get a history of pain and swelling of other joints. Neurological symptoms: symptoms like paresthesias, numbness or weakness may point to a lesion of the nervous tissue, or a lesion in close proximity to it, e.g., a disc prolapse. Extraskeletal symptoms: a history suggestive of abdominal complaints, urogenital complaints, or gynecological complaints may indicate an extraskeletal cause of back pain. Mental status of the patient must be judged to rule out any psychological cause of back pain. Hysteria, malingering, etc. A patient suffering from an organic disease may have an significant underlying psychological disturbance also. Physical examination. Standing position: the following observations are made in the standing position. Position: normally a person stands erect with the center of the occiput in the line with the natal cleft. The two shoulders are at the same level, the lumbar hollows are symmetrical and the pelvis is square. In a case with back pain, look for scoliosis, kyphosis, lordosis, pelvic tilt, and forward flexion of the torso on the lower limbs. Spasm: muscle spasm may be present in acute back pain and can be discerned by the prominence of the paravertebral muscles at rest, which stand out on slightest movement. Tenderness: localized tenderness may indicate ligament or muscle tear. There may be trigger points or tender nodules in cases of fibrositis. See page 304. Pain originating from the sacro-iliac joint may have tenderness localized to the posterior superior iliac spine. Swelling, a cold abscess may be present, indicating tuberculosis is the cause. Range of movement, there is limitation of movement in organic diseases of the spine. 1. Must carefully differentiate spinal movements from the patient's ability to bend at the hips. Lying down position, in the supine position the following observations are made. Straight leg raising test SLRT, this is a test to detect nerve root compression. Neurological examination, sensation, motor, power and reflexes of the lower limb are examined. This helps in localizing the site of spine pathology. Peripheral pulses, the peripheral pulses should be palpated to detect a vascular cause of low back pain, which may be due to vascular claudication. The skin temperature in the affected leg may be lower. Adjacent joints, often, the pain originates from the hip joints or the sacroiliac joints, hence these should be examined routinely. Abdominal, rectal or vaginal examination may be done wherever necessary. Chest expansion should be measured in young adults with back pain. Investigations. The diagnosis of back pain is essentially clinical. There is no use getting X-rays done in acute back pain less than 3 weeks duration, as it does not affect the treatment. On the contrary, X-ray examination is a must for back pain lasting more than 3 weeks. It is almost an extension of the clinical examination. There are a number of other investigations like CT scan, MRI scan, bone scan, blood investigations etc. One has to be very thoughtful in ordering these investigations. Order only when you think it is going to change your line of action, or if the clinical diagnosis is doubtful. Radiological examination, routine X-rays of the lumbar, sacral spine AP and lateral and pelvis AP should be done in all cases. These are useful in diagnosing metabolic, inflammatory and neoplastic conditions. Though X-rays are usually normal in non-specific back pain, these provide a baseline. X-rays should be done after preparation of the bowel with laxatives and charcoal tablets. CT scan has replaced more invasive techniques like myelography etc. It shows most bony and soft tissue problems around the spine and spinal canal. MRI scan is an expensive investigation, now available in big cities. It delineates soft tissues extremely well and may be needed in some cases. Blood investigations, these should be carried out if one suspects malignancy, metabolic disorders, or chronic infection. Electromyography, if nerve root compression is a possibility, electromyography, EMG, may be appropriate. Bone scan, it may be helpful if a benign or malignant bone tumor is suspected on clinical examination, but is not seen on plain X-rays. Treatment. Principles of treatment. Most back pains falling in the non-specific category have a set program of treatment, mostly conservative. It consists of rest, drugs, hot packs, spinal exercises, traction, corset and education. Regarding the prevention of back pain. Major causes of low back pain. Congenital disorders. Spina bifida, this and other minor congenital anomalies of the spine are present in about half the population, but are not necessarily the cause of back pain. Therefore, other pathological conditions should be ruled out before diagnosing this as the cause of symptoms. Treatment is for non-specific back pain. Transitional vertebrae. A transitional vertebra is the one at the junction of two segments of the spine, so that the characteristics of both segments is present in one vertebra. It is common in the lumbo-sacral region, either as lumbarization S1 becoming L6 or sacralization L5 fused with the sacrum, either completely or partially. Traumatic disorders. Back strain, acute or chronic. The terms back strain and back sprain are often used interchangeably. Most often this arises from a trauma sustained in daily routine activities rather than from a definite injury. People prone to back strain are athletes, tall and thin people, those in a job requiring standing for long hours, and those working in bad postures. Sedentary workers and women after pregnancy are also frequent candidates for back strain. Acute ligament sprain may occur while lifting a heavy weight, sudden straightening from bent position, pushing etc. Treatment is non-specific. As discussed earlier, compression fractures. These fractures occur commonly in the thoracolumbar region. Treatment depends upon the severity of compression. It is important to be suspicious of any underlying pathology. Diseases such as early secondary deposits in an elderly may produce a fracture spontaneously in one or multiple vertebrae. Inflammatory disorders. Tuberculosis. Spinal tuberculosis is a common cause of persistent back pain, especially in undernourished people living in unhygienic conditions. Early diagnosis and treatment is crucial for complete recovery. Ankylosing spondylitis. This should be suspected in a young male presenting with back pain and stiffness. Symptoms are worst in the morning and are relieved on walking about. Spinal movements may be markedly limited along with limitation of chest expansion. Tumors. Both benign and malignant tumors occur in the spine and the spinal canal. Tumors of the spinal canal, usually benign, are classified as extradural or intradural. The latter can be either intramedullary or extramedullary. These tumors are usually diagnosed on myelogram or CT scan. Tumors of the spine are mostly malignant, usually secondaries from some other primary tumors. Some commoner tumors of the spine are as benign tumors. These are uncommon. Osteoid osteoma is the commonest benign tumor of the spine. It causes severe back pain, especially at night. Typically the pain is relieved by aspirin. The tumor, usually the size of a pea, is found in the peduncle or lamina. Hemangioma also occurs in the vertebral body. Meningioma is a common intradural, extramedullary tumor which presents with back pain or radiating pain. Malignant tumors. Multiple myeloma is the commonest primary malignancy of the spine. Metastatic deposits are extremely common in the spine because of its rich venous connections, especially with the vertebral venous plexus. Pain often precedes X-ray evidence of a metastatic deposit. By the time a deposit is visible on X-ray, the tumor has replaced about 30% of the bony content of the vertebra. A bone scan can detect the lesion earlier. Approach to a patient with back pain. The source of back pain is difficult to find because of variable factors. The aim is to identify the pathology that needs immediate treatment, such as an infection, neoplasm, disc prolapse etc. All other back pains are treated as non-specific back pain with more or less common treatment program. While the patient is on this treatment program, he is reviewed at regular intervals for any additional signs suggesting an organic illness. First, establish whether the problem is acute, 3 to 6 months, or chronic, longer than 6 months. If it is an acute pain, whether it is related to a definite episode of trauma or is spontaneous in onset. The causes are accordingly worked out. In cases with chronic back pain, it is helpful to judge whether it is mechanical or inflammatory by asking the patient whether rest brings relief or makes the pain worse. Accordingly, further signs and symptoms help in diagnosis. Thanks for watching the video. Please don't forget to like, share and comment this video and subscribe to my channel Dynamic Medicos.